Greetings, everyone. Welcome to Social Works Macro Social Work Stories. Macro Social Work Stories. We have some guests here on today who will share about their social work journey, their experiences, and the work they do in our communities. I am Dr. Jones, and we have two other hosts. We have two hosts that will interact with us and engage as a process. We have Dr. Steve and we have Dr. Christy, who will also join us as we go forward. We want to thank you for joining us for Macro Stories. At this time, we're going to introduce Dr. De La Cruz and Miss Candelario. And so hopefully I got that right. If not, we will be corrected in that process. But we want to welcome you to Macro Social Work Stories. We want to welcome you and just tell us who you are and one fun fact about yourself as we begin our journey. We will go either guest who can go first.
Elsa, would you like to go?
I will defer to you, Dr. De La
Okay.
Cruz.
All
Please
right.
feel free.
All right. So my name is Dr. Jesselly de la Cruz. A little bit about myself. I'm a licensed clinical social worker. I have a master's and a doctorate in social work from Rutgers University. I was born and raised in New Jersey. My family's from Dominican Republic. I was, born in the United States. I'm a child of immigrants. And my day-to-day work is with the executive director for the Latino Action Network Foundation. We're a statewide policy think tank organization focused on advocating on different social issues. We believe all issues, in the words of Christian Estevez, all issues are Latino issues. So we do a lot of work in all different fronts. And then I also have like a part-time job as a clinical director. I do have a clinical job, clinical training, and I'm a micro social worker as well, as clinical director for Healing Space at the YWCA, which is a rape crisis center for in Bergen County.
Okay.
So that's a little bit about me and my work. I'm also a lifetime member of the Latino Mental Health Association. So a lot of different hats and roles and things that I do.
Yes, we want to thank you for the work that you do. You noted that the Latino issues are everyone issues or any issues in Latino issues. So we thank you for that powerful introduction at this time. Our next guest will share with us.
Hi, I'm Elsa Candelario, and so I won't make you say it that way. If you use the English enunciation, it would be Candelario. I'm a graduate of the Columbia School of Social Work, secured my MSW many years ago, worked in New York City for some time, and made my way to South Jersey. And I've worn lots of hats, including serving on several governors' councils, the Blue Ribbon Council on Immigrant Integration, the Commission on the Status of Women, and other commissions. And I've worked closely with Dr. De La Cruz for the last, she's worn a couple of hats, but over the last 15 years or so, which we'll be talking about. And I think a fun fact about myself, my students appreciate this maybe a bit more than the wider audience, but I teach in a dorm last year and this year, and there are classes in the basement of the dorm, and I actually lived
Oh,
in that dorm during my
Wow.
freshman year many
okay.
moons ago. So that's a
Okay.
that's a fun fact.
Yes, interesting, interesting. Teaching in the dorm that you matriculated in and began your journey in
Yes.
this wonderful field, diverse field, that
Yes.
process. Yes. So thank you all for sharing fun facts and talking about the history. You noted that you all have known each other for over 15 years. Uh, how did you all begin connecting and partnering to address issues in our community?
So I was an executive director of a nonprofit agency in South Jersey, a Latino serving agency, and we were fortunate to have an association of Latino executive directors. It was called Hispanic Directors Association. And through that work, I met Jesselly. She was our administrative assistant at what was called HDA. And I was the vice president of the board and became president of the board. But so that's where our work together began. And Jesselly,
Mhm.
perhaps you were a student back then at
I
Rutgers?
had just it was my first job out of undergrad. My undergraduate degree, I have a bachelor's in political science, and
Mhm.
I did several internships, and I did an internship with the Center for Hispanic Policy Research and Development, which is as like a governor's Hispanic fellow, and I did an internship somewhere at the New Jersey Division of Elections. And through that internship, I got notice of a job opening at HDA for
Mhm.
an entry level job in nonprofit work, and I was looking for a job because I wasn't sure if I was going to school or not, or and that's where I met Elsa. My first introduction to macro social work was at that job. I wasn't a social worker yet,
Okay.
but I started to meet people like Elsa who were, and the first task I had was to support organizing a Latino mental health roundtable, a policy roundtable, and just gathering and helping to administratively organize that project
Okay.
and produce a policy report from that. So I learned a lot in that process, and that's really
Mhm.
I even learned like what becoming a social worker is actually.
Wow.
I didn't really know what that was until that roundtable, and that was actually probably the main reason I pursued a social work degree. I hadn't really thought of what other things I would do. I thought about law school and things like that. But then I after a while, that's how I became entered my MSW career, and actually my social career was through that interaction, that work experience.
Mhm. Yes. So networking and being exposed to social workers in executive leadership, and not just any social workers. Am I saying it right? Latino social workers.
Mhm.
Yes,
And that's
that's
a distinction. And we may not
true.
have the opportunity to see that, experience it, and we may not value that all the time. And so, can you share, either of you, being able to be in positions as an executive, your gender and ethnicity are two factors that play a critical role in how you view uh, how we work with our members in our society. Can you share from your experience those two intersections?
Well, for me, it's funny because just thinking back onto the HDA period, the board was largely male, and I've been in those spaces quite a bit where most of the executive directors have been male. Of course, that's changing a bit. But so I've been the only woman at the table. I also served on the governor's commission on the status of women, so I have kind of
Mhm.
explored women's issues statewide on a larger scale basis. And also being the only Latina in the room, I found it powerful to work across collaboration with other groups. But I do think it's important to model and to let students know that social work is a viable career, that
Mhm.
social work is not just clinical work, that social work is work that impacts systems, that social work is a viable career. We don't need to
Mhm.
be starving social workers to be
Yes.
Mhm.
effective in our work, right? That's
Mhm.
often the stereotype of the social worker. I guess I would add that at Rutgers, we do have a specific certificate program for working with Latinos.
Okay.
It's called the LISTA certificate program, and I direct that
Wow.
program. But that's a direct extension of my, 3 decades of work with the Latino community and 3 decades of work with trying to improve services for the community, and 3 decades of really trying to mentor folks to be drawn to social work with Latinos.
Okay. Okay. And so when you said viable jobs in social work, I saw my co-host, he perked up. And so I know he had some question about social workers and having viable jobs and access to not just livable wages, but wages that are respectful, like other disciplines.
Mhm.
Dr. Steve?
Well, yeah, I'm interested. I'm not going to talk about what I've been doing, but I am interested in um, hearing about what the foundation is doing compared to 15 years ago. You know, it's interesting. Jesselly, you mentioned 15 years ago you were looking at mental health issues related to the different Latino communities. Here we are 15 years later. I wouldn't be surprised if some of those issues weren't still at play, maybe for different reasons. But it would be great to hear what it is specific. If you had to make a comparison between 15 years ago and now, what would be the same and what would be different?
Oh wow. So actually that's very interesting that you're bringing that up because we're actually we're still working on Latino mental health issues, and Elsa and I just worked together. I had the report right in front of me, and you can find it on our website in English and Spanish, where we held a policy roundtable again, 15 years later, to discuss the state of mental health, Latino mental health services, or mental health services and Latino communities, right? And like that ability and in the midst of a pandemic, where Latinos are disproportionately affected in deaths. 43% of the deaths of people under the age of 50 were Latino men. And those are not biological kind of, because of where you're from, you get COVID faster. Those are all social structural issues as to why they were more likely to die because of COVID. So we're looking at mass numbers of grief, right, in Latino communities. We're looking at lack of access because of immigration status, in terms of coverage, language access, workforce to actually treat the population, and training and kind of bridging that gap for where that isn't happening. And there's a lot of places in the state where that's the case. So we did, Elsa, jump in at any point here with this issue.
The issue of the differences, unfortunately, we did make some strides over the 15 years, but some of those strides were peeled back during times of recession, particularly in 2008, 2000 to 2010. And so there has been an influx of funding into various states for mental health services. And we're still having conversations with policymakers about ensuring that there is a focus on serving the Latino community. We don't see enough services. Most Latinos are receiving services in an outpatient setting, and there are very, very long wait lists for those bilingual slots that are available. So there are two issues at play. One is, of course, funding, but the other is also the workforce development piece, right? We need more social workers who are bilingual to enter schools of social work. We just do. The CSWE says there are roughly 14% that who are Latino. That doesn't mean that 14% are bilingual.
And I was gonna jump in there, Elsa, because this is something we always say. We're saying bilingual. We didn't say Latino, right? Like it's language. It's not ethnicity that we're asking for. So that's controversial in and of itself. The idea of contributing to the development of an individual that speaks different languages for practice and what that looks like. But that's really, really what we're advocating for is bilingual, not specifically just Latino. That's a big access issue.
Right. And in places like New Jersey, we have about 21% of the population is Latino. That's a large number. New York City, I think it's 29%. So we've got a huge population with the professionals who really, are not there to meet the need. But so we need investments for sure.
There's no question we've seen, like our school now is in East Harlem, but it doesn't mean we've seen an uptick in the number of applicants who are Latinx or bilingual. We do have a significant number who can speak a number of different languages, but interestingly enough, there hasn't been a huge uptick as much as one would think among Latinx.
I think those scholarships and resources, again,
money.
the investments will, because we do in our BSW program, we see about 30% are Latinx, but they're not making it into the MSW programs. They stop to work, they stop to do other things, and so we're not seeing a huge influx. And I think if we incentivize the pursuit of social work, I think folks will make that choice, because it's an excellent profession and with lots of variety in activities and services, lots of variety in populations that we work with. I'm biased, but I think it's an exciting career.
Well, I think one of the issues, and our other host here, Christy's now on, can speak to this. I think one of the things that schools are going to have to deal with is the level of debt that they can expect students to take on.
Of course, yeah.
Because, like you just said, from undergrad to grad, how much debt are they going to be able to handle and then live and get housing? It's a real, it's a real crisis that's out there.
I would add some other structural issues that kind of I think about when we think about workforce and enrollment. I mean, the numbers still show that the majority of Latinos are primarily enrolling in community colleges first, and that the trajectory going on upward to master's and doctorate, the number dwindles. And I think if you're thinking about the root causes, we can talk about the debt and the economic impact, of course. We did pass some positive legislation like DACA, and making sure that's reinstated, because we do have a growing number of Latinx students that are immigrants themselves, and being able to access licensure. And then the other thing I would think about is that we would have to address educational inequities for people to be able to go on and engage in this work, and that we support that. And that's very like, to me, those are things that are structural racism, right? Something that the Latino Action Network Foundation is working on now is doing community education outreach around continued de facto segregation in New Jersey school systems. And the fact that how can we then expect students to overcome all that, including accessing all this debt to be able to do that? It's just we're setting up students to fail. And then that's hurting us on the other end with the health equity piece. So I think there's a lot of issues at play there, even when we think about things like licensure and what that means for tests and people who are entering the field, English as second language learners. There's a bunch of issues there that, are very difficult to address. Because they're what legitimize our organization, but what legitimizes the organization usually keeps a more marginalized community out, if that makes sense. Just particularly given all the other systems at play.
Yes. And so we see some of the projects that you're working on at this resources, equity and education you talked about, community outreach presentations and reparations in New Jersey, and the New Jersey Mapping Project. When trying to encourage Latino X to enter this field, how can those projects be utilized to bring attention to the profession as well as issues in our community?
Is that mostly for me? I'm assuming, right? Because thinking from the foundation. Well, we are about empowerment and civic engagement. So, and I think, when I think about Elsa, I mean, every day that I show up to work, I think about women like Elsa, women like colleagues I've met who are in positions of leadership and using their voice, that are in spaces that are primarily male dominated or white dominated. So I think it's important to model what we're doing, that we can be engaged in these issues and making it accessible to people to feel like they have a role in government, like they have power to do things. And we have successes that we try to build upon, driver's licenses in New Jersey. Yes, it takes decades sometimes, but but collective action works. It works when you make it work, and sometimes there are setbacks. But I think New Jersey is in a much better place than it was 15 years ago, um, in certain aspects to be able to access things. So I just think we need to build upon our successes and show the community that the movement is in their benefit and not to, like, exploit. That those are often, the contentions that we have ethical responsibilities to think about, as we engage in practice, macro practice.
Mhm.
Hi, Christy, were you going to say something?
Well, you guys were covering it, but Jesselly said, she brought it up, gender. So I was thinking, what would be a question that would cover a lot of what we're talking about? And I was wondering if we can ethically recruit single mothers in the programs of social work. And if the answer is yes, how do we do it? And I think it covers a lot of these levels that we're talking about of exploitation, debt loads, the expectations of work when they're done with the program. How can they go through the ranks, and how can it be a fulfilling career if we're recruiting single mothers? And can we equitably recruit single mothers, period? I mean, question mark, I guess. But how do we do that? I mean, we already do it, but I think that there are a lot of issues with what ends up happening to them later, when they take on the debt load as a single mother in the first place. So talking about childcare, a lot of those things start feeding in, same as employment, but it's very hard for them to, the sell gets more difficult the longer they're in programs or after they're out of the program and then working and paying back student loans while also trying to pay for childcare, et cetera. So I think if we start shaping programs answering that question, we may do a better job at recruiting and retaining. Is it actually a sustainable career?
My view is that, it is a sustainable career. I think more investments need to be made. I mean, that's a very big question. It's not only for social work, it's really a societal question.
Yeah.
And, obviously, childcare. I have 3 children of my own, and it's extraordinarily expensive to take care of children while one works. And so, investments in childcare. There are child tax credits now that are in play. And a lot of these policy issues around, kind of choices that we make as a society. To me, these are macro issues that social workers can and should be involved in. Most social workers are women. It is a female-dominated field.
Like teaching and nursing.
Like teaching and
Same
nursing.
question, yeah.
And, to just speak to the issue of gender, in all of female-dominated professions, we also see this concept of the glass escalator, right? Where males rise to the top in female-dominated fields. So in teaching,
That is real.
principals, superintendents, and in social work, executive directors and administrators and deans of schools.
Boards, yeah.
Even
And
subordinates.
boards.
Even
And boards.
subordinates are
Yes.
above, I think it's just so interesting, even
It
the
is.
fact that I ask, and I'm really grateful when people do call me Dr. Dela Cruz, because it's so common even to be in the leadership and enter the room that you cannot even be acknowledged as the leadership. If I answer with a male colleague, and have those responsibilities get and it's so interesting. It's such an interesting dynamic. And I think, I just think it's very interesting when you're thinking about things like single mothers. I mean, that I agree with Elsa. That's a huge macro issue, which is why I think more social workers really need to find ways to become more politically invested, right, in things like these federal policies like minimum wage and like universal child care and coverage and coverage for health coverage for all and pay equity and all these paid family leave like things that will really benefit everyone, but for some reason don't get passed.
If
You
I
know,
can
it's
just add that when I became executive director in the 90s, in the late 90s, my organization had healthcare coverage and only covered 100% of the premium for the worker and not any dependents. And after some time, a few years in, I thought, here we are, our name has family in it. And we're kind of promoting health and wellness, but our staff are being covered by governmental assistance for their children and for their dependents. And I felt like that was not walking the walk. And
good for
so
you.
I started to work with the board, and while we knew it would be more expensive, with just making the case, I was able to get them to see that it was important that we cover our employees and their dependents. And there was, it meant that everyone had to pay something toward their premium, right? So if you were a single person, you had to maybe cover 5% of your premium, and with dependents, 10%. We made those choices. And the staff was so good about it. Those who had to pay a little bit toward their premium, they said, that's fine because I want my peers to have coverage for their family. It felt like the right thing for everyone. There was no blowback at all. There was complete buy-in. And we were able to we made the choice to cover our employees and their dependents. We had lots of folks who added dependents, and it was a good thing because there were folks who had no insurance at all and were sick. And so I think that we can do that on a small scale in our organizations, but we can also think about doing that kind of work on a large scale. And I think a social work perspective is important to have in those conversations.
Well, it'd be great to, your story would be a great one because you'd be amazed at the number of executives. Well, you probably wouldn't be amazed. The number of executives who do not take that point of view related to their staff. We won't get into that, but I'll send you both a little bit something that I've been working on. I know Christy's been working on this as well, related to what these disparities are about that are within our field. Just to give you one quick example that ties to Latinx social workers in in New Mexico, which has had consciously increased the number of worked hard to recruit more students into the field. Get this, they're now offering graduating MSWs $18,000 a year for their starting salary. It's unconscionable.
What?
I know. I learned this from.
I was waiting for the scholarship. I was like $18,000 scholarship.
I thought
Okay.
additional stipend.
year
No, that's their pay.
I was like,
That's their
what
pay.
fellowship?
It's like, really? So
very low.
Oregon, $17.96 outside of Portland, an hour.
Yeah.
Anyway, Jesselly, you raised another issue about national. One of the things that happened in the 2020 election was they began to be, I'm very interested in what both of you have to say about this, that Democrats have for too long taken the Latinx vote for granted, and especially Latinx men. This is what the popular columnist wrote about, began to tilt much more Republican. And that this really spoke to a break from the past that's going to have real impact on what Democrats can expect in terms of electoral triumph in the future. So 1A is what the popular column is saying at all accurate? B, if not, why are they saying it? Or B2, if they are accurate, what does it mean and what do we have to do about it?
Jesselly, I'll let you take that from
I guess that's
that's a land perspective for sure.
Yeah, sure. I would say that that's, the Latinx demographic. This shows that it's not heterogeneous in any kind of way. Whenever you think it's going to go this way, it goes another way. So there is a significant portion of Latinx voters that are not Democratic, right? That are conservative and Republican, and you cannot really kind of confirm exactly where that's going to land all the time. The first of all, I think in general, the Democratic Party has done a poor job, especially within New Jersey, of kind of following through with its base, its progressive base. I think sometimes it's hard to tell who's blue and red, especially in New Jersey. And that's a big issue. I think sometimes we look very progressive when we're not, you know, on a lot of fronts, you know, sometimes things that are very performative, like we're great at passing legislation, but like here we are 15 years later, still kind of fighting the same fights and filing segregation lawsuits and things like that in 2021. And I also think that that's why it's very well for us as social workers, and for me, it's very important that at the Land Foundation we take a very active voice in very progressive issues. So that's something that we've been really committed to, and we've actually sometimes lost support among our own community for the stance that we may take on those issues. But we are advocating, you know, not just for Latinos, but as Latinos, and sometimes there's going to be splits. So, for example, taking an active stance on gay marriage equality was not a popular issue with what, you know, many Latino communities. Supporting the Reproductive Freedom Act can sometimes be very controversial with the community, but we have a mission, which is to be a civil rights and progressive organization, and we believe in that, and we take that stance sometimes even when we know there may be conflict, and maybe that's something that Democrats still haven't really figured out how to do. And I think that's a big, I think, you know, they talk about catering to their constituents, but that's not always really what they're doing. You know, I think sometimes party politics takes precedence over politics of the people. And there's a lot of reasons for that. There's a lot of reasons for that. You know, we'd have to get rid of a lot of corruption and everything that goes on with
Dr. De La Cruz and Elsa, do you guys believe that there would be some way to front load recruitment? I'm thinking on the female dominated industries. Everybody knows we need more teachers. Everybody knows we need more nurses right now and social workers. Is there some way for us to perhaps get something past front end so that those who are recruited don't have to pay up front for student loans or tuition, rather than it being something at the back end you're trying to chase for years? Would there be a way for, I don't know if anything exists like that, but a front loaded program to recruit people in may make a difference as well. If you could go in and get the education, obviously time and all of that's going to be an issue for some people, but if it wasn't a financial barrier at the outset, maybe we'd have a chance. So I'm trying to think of things that would actually make it easier to enter some of these fields.
I think we were talking about that a bit earlier about the financial barriers for Latinos. I've been a professor at the School of Social Work since 2020, and I'm directing the LISTA certificate program, which encourages Latinos to be culturally responsive and culturally competent in practice, not only Latinos, but non-Latinos as well. And it is striking that that there are some schools that have been very clever about offering fairly substantial scholarships. We offer scholarships, but certainly it's not half of the tuition. So I think collectively we probably need to think about how we might engage in those efforts to raise dollars for scholarships for students, and also to have student loans forgiven for those who enter a profession like social work. So I think it's multi-pronged. One is to raise the dollars for scholarship, and the other is to encourage government to forgive those student loans.
What
So all these
I'm thinking that the government paying. I'm thinking government paying up front. Forget scholarships.
I think that's a great idea.
And you know, they're doing
And
it
in
now, right?
society, we need it. Yeah.
This is what I love about the
Sorry, I'm
pandemic. No, it's okay, Chris. I think it's interesting because they're doing it now. And I think like the pandemic has made things possible that before we're like, what? We can't do that. You know, like universal testing and vaccination access on a major medical problem. Like what? Now it's like completely a thing, right? And it's funded and we're doing it because the economy depends on it. So let's say if we did that for like 5 other major chronic health issues that people had, you know, I wonder how much healthier we would be. And it's like right now they are giving community college students, a lot of community colleges through the CARES Act, just giving $1,500 stipends to their students each semester for attending school. So it's like here we are in this
Amazing.
pandemic, and all things are possible. We can reduce our prison population in the middle of a pandemic. Things that we couldn't do before, all of a sudden we are able to do. And I think that's something for us to really think about when people tell us we can't, what it actually is about.
Yeah, but I also think too, it's collective action, right? We've
Yeah.
talked about this a lot. We have to engage in collective action,
Mhm.
and so just goes back to the point as to why macro practice is so important. It's collective action, those issues of social justice, issues of parity and equity, these very big policy issues. We need folks who are committed to working on these issues and who are committed to working together on these issues, because I can have an individual opinion, but without other voices, it's very hard to move the needle on policy issues.
Yeah.
Well, I think we don't move very fast on opportunities either. I mean, right now we've got, a lot of headlines showing we've got all sorts of interesting people, thankfully, stepping up to substitute for teachers in school because the teachers are out sick. And then we're having arguments about whether or not it's better for kids to be in school, but now they're at school without teachers. So we're kind of going in this bizarre circle, and we don't have enough substitutes either. So we don't have a pipeline going on that's big enough to cover what we actually need. And so as Dr. De La Cruz just pointed out, if there's, we can get creative and figure it out really quickly when someone decides we should. And so if there's an issue like this that we can jump on board with, I'd love to see our organizations do more as far as, okay, here's a really good example. It's in the headlines. This is when you can actually get members of society behind us and saying, yeah, we shouldn't have this happening here. It's important that the kids are educated by people who are trained to educate them, even if they're substitutes. And I think it goes back to why kids are in school in the first place, or what the push is about to have them in school. Is it to protect the parents? Is it to protect businesses, keeping the jobs going so that there's childcare? I mean, and that's what it's starting to go towards. And I feel like all the different issues, no matter how we slice them, I think we can get bipartisan agreement. I don't know if I just made sense, but if people care about small businesses, big businesses, they care about teaching credentials. They want, everyone to have access to education. So no matter who we're talking about, I think there's ways to reach both sides of the aisle on these issues, as long as we get them when they're in front of us. If we wait until post-pandemic and a year later, everyone tends to forget the urgency of what we have happening right now, or that we have military stepping up as well.
Yeah, I tend to, even in macro practice, I mean, we talk about it in micro practice is Maslow's hierarchy of need. And I think that when we think about the work that we do and which policies go first, because we had that discussion internally at like the Land Foundation when the pandemic hit, like, what are we going to advocate for? What are we going to push for? And we actually talked about like, well, what's first? Like, what are people hitting us with first? And it's like income. Immediate cutoff of income for shutdown. So, we had to make choices as to what we're going to collectively advocate for, and one of that was the New Jersey's excluded, the New Jerseyans excluded fund, and making sure that people who were cut off from federal access to like unemployment because, they don't qualify, that they could get some sort of support during this time, and just making sure that those kinds of efforts were being done. But it took a lot of collective work and a lot of collective action, and there could have been more social workers in the room, I think than there were at the time. So
Yeah.
those are, so, I mean, I tend to think of macro practice from that lens as well. Like, what do people need first, and what can we work on?
Well, as we get close to wrap up, it would be great to hear from both of you, sort of a conclusion back to something you said earlier, which is that every issue is a Latinx issue. Dr. Jones spoke to that. If you could speak to that, because one of the things that bipartisanship is going to require is that white people begin to see that every issue is all of our issues, as opposed to it's over there for that particular group. So your insight about that, I think, would be a great way for us to sort of wrap everything up here.
I always like to borrow from Tim Weiss. I heard him speak many, many years ago. And this is a growing population. And if for no other reason than for our own self-interests, right? Our own selfish self-interests, we need a healthy society in order to support us when we're older, aged, if we want to have a social security system and the social nets that we have in place, right? We need a healthy population that's economically viable. So that's kind of the self-interest argument. I'm obviously a social worker, so I think beyond self-interest in terms of really wanting the community to be healthy, because it is my community, because these are my cousins and my neighbors, and I think there's so much value that's added with the diversity. In New Jersey, we have, again, 21% Latino. It's growing. Folks who are Latino are popping up in almost every region of the state. And it adds an incredible dimension to communities to have diversity of businesses and food and language. And I think it's a richer experience for children in schools to have that diversity amongst them. So I think, there are lots of reasons. America's always been the land of opportunity, and the folks who are coming today, they're coming because they're pursuing opportunities, right? They're not coming because it's easy to come here and it's a cakewalk. They're coming because they want better opportunities, or they're fleeing really oppressive environments in their countries. And so when they come here, I'd like to see them living as healthy a life as possible. I think it's good for all of us.
Thank you for that. Dr. De La Cruz.
I can you repeat the question just so that I can remember? Like, what do we?
The idea that the beautiful early comment about every issue is a Latinx issue.
Yeah.
And your reflection on that for all our listeners to be able to learn from that. I mean, I think Elsa was speaking to that. You'll probably say some things that may go along with what Elsa's already said, but we'd like to hear your words too.
Yeah, I guess, I think there's a lot of fear and fear mongering around people othering, you know what I mean? I think that's you know we have to work collectively to figure out how to overcome that othering, because I think there was a lot of research, no, and a lot of articles about how many Trump supporters were actually advocating for things that hurt them, right? That were actually like hurting them at the end of the day. So that shows how, and this is notorious. Like the moment that conservatives want to build their base, they bring in the xenophobia. It's like calling the xenophobia like all the time with the comments and plastering it all over TV, and just we have to really work at helping people overcome fear of others. And through that, it's sometimes, I hate to say it has to happen by like kind of strong force, like pushing the issue and building a base and, having collective action. It has to come sometimes through lawsuits and forcing people to go like be in situations where they are more integrated and have to look through the lens of other people. and that's why we are like committed to civil rights issues in that way, because I feel like that's really how we get change, is when people start to actually experience other people from other walks of life. And the longer we continue to be in our silos and be fearful and kind of fuel that fear mongering of Latinx and the border and immigration and people of color and you know, it's his or hers. I mean, it's like this or that. I think that's what we have to somehow challenge all the time. That's our biggest challenge.
Yes. Yes. Well, thank you all for coming and sharing your story. And the Latino Latin network collaborating and collective team, and also what we're doing in the classroom. You're doing in classroom as you prepare emerging social workers on how viable and diverse the opportunities are in the field of social work. And so we just want to thank you for coming. We look forward to having you back and talking about some of that research that you are completing to bring about change in our communities. So thank you all, and look forward to seeing you.
Thank
Next time.
you. Thank you for
Thank you.
having us.
Thank you.
Thank you.